STORM-PE was a randomized controlled trial of mechanical thrombectomy with anticoagulation versus anticoagulation alone for acute intermediate high-risk pulmonary embolism. It is a landmark study that provides evidence for the use of mechanical thrombectomy in pulmonary embolism. It was presented in late 2025 and then published in Circulation. The trial used computer-assisted vacuum thrombectomy (CAVT) system. This endovascular therapy uses a dynamic microprocessor controlled system to aspirate thrombus while minimizing blood loss. The study had 100 patients with acute intermediate high-risk pulmonary embolism defined by RV-LV ratio 1 or more and elevated cardiac biomarkers. It was an international 1:1 randomized controlled trial comparing CAVT and anticoagulation versus anticoagulation alone. The primary endpoint was mean reduction in right ventricular to left ventricular diameter ratio at 48 hours. Mean reduction in RV-LV ratio was 0.52 in the intervention arm and 0.24 in anticoagulation alone arm with p-value less than 0.001. Thrombus burden reduction, that is by refined modified Miller score, that was 42.1% relative reduction in interventional arm, while it was only 15.6% relative reduction in anticoagulation alone arm, again with the p-value less than 0.001. RV-LV normalization occurred in 39.1% in the CAVT group, while it was only 13.5% in anticoagulation alone group. Major adverse events occurred in 4.3% in CAVT group, which included 2 pulmonary embolism related deaths, which was not device related, and 7.5% in anticoagulation alone group. The difference was not statistically significant. While the original Miller score was designed for invasive catheter angiography, the refined version adapts these principles to CT pulmonary angiography, allowing for a non-invasive, semi-quantitative assessment of clot resolution. Original Miller score has a cumulative range from 0 to 34. Modified Miller score has a cumulative score ranging from 0 to 40. It is calculated by assigning a score of 0 for no obstruction, 1 for partial obstruction, and 2 for complete obstruction to each of the segmental arteries. The refined modified Miller score also has ranges from 0 to 40, but allows finer distinction of partial obstruction into 3 categories. Patients in the CAVT arm showed significantly earlier normalization of heart rate and lower supplemental oxygen requirements. The CAVT group walked significantly further in the 6-minute walk test at 90 days. This was presented in a conference yet to be published in a regular full-length publication. That was 472 minutes versus 376 minutes, achieving roughly 94% of their predicted distance compared to 75% in the anticoagulation group. There was no device-related deaths and no significant difference in major bleeding or pulmonary embolism recurrence between the 2 groups. The STORM-PE trial is considered foundational because it moves beyond single-arm registry data to prove that mechanical thrombectomy is superior to standard anticoagulation for rapidly reversing right heart strain. While the study wasn't powered to show a mortality benefit, the significant improvements in both short-term hemodynamics and long-term functional status are expected to influence future pulmonary embolism treatment guidelines.